Hi, I'm Dr. Surindher. I'm the director of Cosmesis India. We are an aesthetic surgery, plastic surgery clinic in the heart of Bangalore on Brigade Road. There is a recent trend of threads or thread lifting you will always hear about in the news and in the papers, and a lot of your dermatologists must also be telling you about it. And these are all called dermal threads. Now, what do you mean by dermal threads? Dermal threads is basically the dermis is a layer in the skin. There is an outer layer which is the epidermis that you see, and then there is a dermis which is basically the cushioning layer of the skin, and then you have the subcutaneous fat and then the other muscles under the skin. As we are aging, what happens is the dermal layer, which is the main cause or main part of the skin which provides the subtleness, the suppleness and the elasticity, that is thinning out because of the loss of collagen. So what the dermal threads do is basically the threads are made out of something called PDS, which is basically a suture material. And what the PDS does is, as it gets dissolved or absorbed into the body, it initiates a reaction in the body to form collagen, or basically it is the fibroblastic reaction, and then there is a collagen formation. That is the basis of how the dermal threads are supposed to work. Now, if the threads are put in multiple strands and then the collagen, it is replaced by collagen, what happens? The collagen, once it is in the dermis, it of course improves your collagen of the dermis, and secondly, as the collagen matures, it tends to contract. It is supposed to help you lift the skin up. So we place it along the vectors of the lift that we want. Like if we want the cheek to be lifted in this vector, then this is the vector that we want it. So we place the threads in that layer, and that is how the threads, as they contract, you will lift it up. A second effect which happens is when you're putting the threads, we usually do a crisscross pattern or we do a longitudinal pattern, and this will form a mesh of collagen. So that is what is supposed to give you a support to the cheeks. The initial effect that you see is purely physical. That is because of the threads being put there, your cheek is splintered because of the physical threads being present. So that itself gives you a flatter look, and instead of the sagging, rounder look that you see as we age. So that is the immediate effect. The long-term effect, which usually is seen in 3 to 4 months to 6 months, is when the threads are absorbed, the collagen is formed, and the skin is lifted. These are all subtle lifts. These are called free-floating threads because they are not anchored anywhere into the head. You have the anchored thread lifts also, but those are a different topic. The most common free-floating thread lifts, what you hear about now, are these. They are the dermal threads. They are basically to improve your collagen back in the dermal layer of the skin, which is basically an elastic layer of the skin.